Thank you so much, Stacy, and welcome. Good evening, everyone. Thank you so much for joining us tonight. We're going to have a discussion around COVID-19 and keeping families safe during the holidays. I'm Dr. Monroe, and I am at Wake County Health and Human Services Center at Departure Drive in North Raleigh. So tonight we'll talk about COVID-19, boosters, and keeping families safe. Going into the holidays, it's really important that we're working hard and thinking about this and how to keep everyone safe. And we know that many families will be traveling all over the country. So we will talk about traveling safety and keeping everyone safe and healthy during the winter season. So flu season has already started and more people will get sick during the winter months. We always recommend getting the flu vaccine, but additionally, healthcare providers are recommending receiving the COVID-19 booster shots for extra protection against COVID-19. As of November 9th of this year, the North Carolina Department of Health and Human Services COVID-19 dashboard reported that 57% of residents who identify as African American or Black have received at least one dose of COVID-19 vaccines. But as of the same time, only 54% of Black or African American residents had received one dose as of January 3rd of 2022. So there's not been much increase since January through November. The COVID-19 dashboard shows a visual display showing a leveling off point of these vaccines and declining interest of vaccines for community members. 66% of residents identifying as white have received vaccines, and 92% of those identifying as Asian or Pacific Islander have received at least one dose of the vaccine. So there is a great health equity concern for the residents of Wake County. And we know that, evidence shows that Black or African American individuals show severe COVID symptoms, hospitalizations, even deaths at increased rates compared to white residents due to underlying health conditions and systemic racism. So it's really important that we continue to inform our community, share accurate information with our friends and loved ones regarding COVID-19 and its health concerns. It's important to protect our more vulnerable community members, such as older adults, younger children, and those with underlying health issues like diabetes, high blood pressure, and immunocompromised conditions. So let's get started. I am here today with Dr. Stephanie Etienne, a family physician. And again, I am Dr. Rasheeda Monroe. I'm a pediatrician. And we are just going to get started. And we're going to start opening up to some questions that we've already fielded from our community members. And we welcome and encourage you to submit your questions for the event. You can submit them through YouTube or Facebook, and the link is posted. So first, Dr. Etienne, I want to have you introduce yourself and talk about some of the work that you've been doing during this time of COVID. Dr. Etienne.
Hello, thank you, Dr. Monroe, for that introduction. It has been quite an adventure with COVID. I guess we can all say that. I'm a family physician, and I've worked on the front lines with the vaccine, with COVID, working in the urgent care as well as in my clinic. So I've seen over almost the last 3 years how things have really transformed with the virus. Initially, of course, there were no vaccines, and we were pretty much like sitting ducks, hoping that we wouldn't get COVID. There was nothing to protect us. So thankfully now there are multiple vaccines that are very safe and effective that can decrease our chances of contracting COVID, as well as decrease our chances of potentially dying or being hospitalized due to COVID. So I'm very pleased that we've come so far, but I have strong concerns that people are becoming complacent. There are still people contracting COVID at higher levels than what we would like, and people who are being hospitalized and dying from this virus. So it's still something that we need to not take for granted and be safe and do everything we can to prevent the spread of this disease.
Thank you so much, Dr. Etienne. And as you notice, we're actually together in the same room, which is exciting that we are live from the venue with some community members here today. But thank you so much for that introduction. And I know that you have been on the front lines. I have been working with you quite a bit over the past couple of years. And you're right. It wasn't but a year ago that, adults had access to COVID-19 vaccines, and we still didn't have that for children. And I can remember going into the holiday season last year with our family, and my children still weren't, vaccinated, but this feels really different, right? We have so many tools at our disposal. We've got our vaccines that are safe and effective for children 6 months all the way through adulthood. We've got boosters available for people 5 years and older. And so as a pediatrician and as a mom, I definitely feel differently about this holiday season. And I'm looking forward to gathering safely together with with my family. So let's get started. My first question is for you, Dr. Etienne. Generally, how would you recommend that people stay safe during the holiday season? How can they gather with their loved ones in a safe way? What would you recommend?
The first thing I'd recommend is to be vaccinated. If you're not vaccinated, there's still time to get vaccinated. And by being vaccinated, you need to make sure you are fully vaccinated, including making sure you're up to date on your boosters. That's the first thing. And even if you are vaccinated, you still need to be safe and take precautions, especially if you're going to be around a large group of family members or friends. And if that involves people who have compromised immune systems, people who are younger, or people who are unvaccinated. Just being vaccinated alone is not the only thing. You still have to be safe and be cautious, because there's still a chance that you may contract the virus. So still adhering to those 3 W's, waiting, keeping space between each other, wearing masks if you're in large groups, and frequent hand washing. We still need to keep doing those things.
Excellent. It's like the message we've been giving for the past 2-3 years now. I like how you said, especially if you're going to be around people who are vulnerable, so the very young, the very old, people with compromised immune systems, be vaccinated. Are you recommending that people test, do COVID tests prior to gathering with families if they're going to be together, especially with vulnerable people?
I think that's a very good idea. The tests are readily available. You can get them for free. Undoubtedly, we find that people who think they're feeling okay or I'm vaccinated, when they're tested, they have an incidental finding of a positive test. And you're putting other people at risk unknowingly. No one wants to hurt people, but sometimes that happens. So if you're going to be with a larger group and you have access to tests, by all means, use those tests and test the people who will be attending the event.
I love that idea. I also still like, thinking about ventilation, right? Anytime you can have something that's open air or some cross currents going on in the house with, windows open in the front and the back, anytime that you can increase the ventilation, you're going to make that a safer space from, contracting respiratory diseases. So we've got a couple of things going on right now, though. We've got COVID, flu, and RSV. It's like the trifecta of respiratory disease. Should people be worried about getting the flu? And how do they know if they have the flu or if they have COVID? What's the difference?
Unfortunately, our flu numbers are increasing tremendously. And this is largely in part due to the fact that people aren't masking as much, and people are kind of relaxing a lot of the precautions that we were using as far as protecting ourselves against COVID. So the numbers for flu are going up. In addition to getting a COVID vaccine, we do still recommend you get your flu vaccine. So getting vaccinated as soon as possible against the flu. Our season pretty much started earlier than what we would like, so we're seeing a whole lot of flu cases. So getting the vaccine after getting the vaccine, it takes about 2 weeks or more before you're protected against the flu. So just because you get it doesn't mean that same day you're not going to be protected. So it's better to get it as soon as possible so that you can be protected throughout the flu season. And how do you tell the difference? Sometimes it can be difficult to tell the difference because the symptoms are similar. People with flu, for the most part, tend to be more likely to develop a fever and body aches. With COVID, you may or may not see that. But the best way to differentiate, of course, to fully differentiate, is to be tested if you have symptoms that are concerning for either disease. There's easy access to test for both COVID and flu. So it's important to test to make sure that you don't have those conditions and that you're not going to spread it to others.
Yeah, it really can be very challenging to differentiate. And then you've got RSV on top, right? So I'm a pediatrician, and all day, every day, I feel like this is what we're doing, is trying to differentiate between COVID, flu, RSV, or every other viral cold out there. And, you know, people present with upper respiratory symptoms, cough and congestion and fever and headache. And in children, oftentimes we're testing sometimes for all three, especially if they're under 2 years old. Children under 2 are more susceptible to RSV that can be more severe. So RSV, respiratory syncytial virus, is just a cold in you and I for the most part. A lot of cough, a lot of sneezing, a lot of runny nose. But in children under 2, it can really cause, you know, trouble breathing. We call that respiratory distress, really working hard to breathe. And they may need even to go to the emergency department or the hospital to get some support to help them be able to breathe and to get through that. I was just reminding one of my the patients' moms today that there's COVID, there's RSV, and there's flu. And 2 of these, we have protection that's readily available for everyone. You can get your flu vaccine, you can get your COVID vaccine. There's not something that's readily available for everyone for protection against RSV. Not yet. But, you know, for children who were preterm, who have heart disease, there is some protection that is available to them, but it's very, very limited. That's not something that's available to most people. So for the most part, protect yourself against the things that you can. Avoid people who are sick, wear your mask, wash your hands, get vaccinated. All right, so the respiratory trifecta. And you know, I know you and I both have been seeing a lot of all of the above, but our hospitals are really kind of overrun with respiratory illnesses, more than anything I've seen in my 15 years of practicing since residency. More flu than I've seen, and more hospitalizations for RSV than I've ever seen. What are you seeing in your adults? I know you see children and adults. What are you seeing in adults?
In adults, we're seeing quite a few people who have both COVID and flu at the same time. And thankfully, I will say that people who are vaccinated against COVID, their symptoms are milder. When I compare how things were pre-vaccine, and people would come in, they would be so sick, they'd be hospitalized. And unfortunately, we had people who passed away due to the COVID virus. So now we're seeing elderly people who are fully vaccinated. They come in with COVID, and it's kind of like a cold for some of them, or they don't even know, they think they have a sinus infection. So we've come a long way, and that's just a testament to how effective these vaccines are.
Thank you so much. That is scary. When you said some are coming in with COVID and flu at the same time, I kind of shuddered. That can be scary. So what are you thinking about the subvariants? You're hearing about it in the news. Are we to be worried? I'm having worry fatigue, Dr. Etienne. What do you think? What do you think about these subvariants?
The bottom line is, like I keep stressing, we have wonderful vaccines and we have wonderful boosters. There are going to be subvariants. You know, the virus is very smart. It can modify itself in response to, with time, and as it infects multiple people, it modifies itself. So it's something that we're going to deal with. It's something that's going to be here. So it's nothing that we can necessarily worry about. We have something to protect ourselves against the virus. So the best thing to do is to stay updated and make sure you have the most updated booster available. Now we do have the bivalent boosters, and those boosters protect against the regular strand of COVID, as well as the subvariants, mainly the Omicron variants. If each day, almost every day, there's a new subvariant of Omicron. The most common one we're seeing now is the BA.5 variant. About 50% of cases in North Carolina, as well as this country, are due to that variant. That variant is very, very contagious. But there is some good news. People who are vaccinated, you may still get it, but you'll be over it in a few days for the most part if you're vaccinated. If you're not vaccinated, it's more likely that you may have more severe symptoms, have to be hospitalized, or potentially, unfortunately, have a worse outcome, such as death due to the virus. So getting that vaccine is key.
So let me just ask one more question about traveling and being safe. So masks are no longer mandated anywhere, right? I just came back from a conference and I was on an airplane. What I chose to do was wear my N95 mask because I'm sitting on an airplane with 99% of the people are unmasked. And I know that's going to be excellent protection for myself from COVID and the other respiratory illnesses. But what are you recommending for people to do with masking now that masks are no longer mandated as they're traveling and seeing family?
I definitely recommend that people wear masks, especially if you're going to be traveling on a plane or a train where there are a lot of people. If you're going to be in a crowded airport, it just makes good sense to protect yourself and others. I mean, you could be sick and don't know it. You don't know what other people around you have. They could be sick and not know it. And it's very likely that during this season, someone has something that you don't want. And that mask can protect you against COVID, flu, RSV, or any other virus that could potentially affect you. So it's highly, even though masks aren't mandated, I think it makes good common sense as far as keeping us safe and healthy to wear a mask in those settings.
Thank you, Dr. Etienne. We've got a couple of questions from our community members. The first, before we open it up to our live in-person audience, someone asks that they are worried about loved ones and how can they encourage them to get the vaccine. And, you know, I feel like we're still on this kind of mission of trust building. And I honestly, as a pediatrician, I have this conversation daily with patients and their families. And I'm surprised every day with just a gentle recommendation and conversation how many people say yes to getting vaccinated. I mean, you might think that we're so far out from vaccines being available for the first time that if someone wanted to get vaccinated, they would have already, but sometimes it really just comes down to opportunity being offered, being in the right space at the right time, being open to hearing it. So, you know, I don't think it's the you know, the right approach is, you know, blaming or shaming or beating people over the head with it, but just having like, you know, a gentle dialogue about it, seeing if you can, you know, allay some of their fears, you know, answer some of their questions. But I'm surprised every day at how many people are still open to getting vaccinated who haven't been vaccinated yet. Are you seeing that? What are you seeing?
Yes, I'm seeing the same thing. And I think, like you said, it's important not to shame people or belittle people for choosing not to get vaccinated. It is their choice, and they make a choice based on the information that they receive. Sometimes it takes multiple times. It may take 10 times before that person, something clicks with that person and they feel more comfortable getting the vaccine. Sometimes when people have family members or friends who have become sick due to COVID, or they see, you know, people who they thought who look like them, or they think they're healthy, and they see other people who are healthy who come down with the virus and get sick. There are various reasons why people are hesitant, but I think we shouldn't give up. We should, just meet people where they are and answer questions. And sometimes it takes that family member or a friend that they trust. But I do recommend that people, if they have a physician, talk to their physician about the vaccine. Their physician is knowledgeable. The physician knows them and their health situation, and there's a certain level of trust there.
Yeah, absolutely. Thank you. Thank you for that. So I'm going to open it up to our live audience who is here with us today. And first, I'm going to have you introduce yourself, state your name, and then speak up for us and ask your question.
Okay. Good evening, everyone. My name is Sharon Bradwell. I am a family advocate at a Head Start program, and the children ranges from ages 1 through 4. So my question is, as a healthcare provider, how would I identify if a child has been exposed or potentially have RSV? And if we do identify that that child does have RSV or may have RSV, how do we then protect the other children in the classroom?
That is an excellent question. Thank you so much for asking that. Like I said, for RSV, it really is it's a snotty cold, right? So it may not look any different than any other snotty cold. And so I think my advice would be to use the protocols that you have in place at your child care center, the things that would keep a child from being in that space if they were, had a fever, if they, weren't, eating well, if they seemed sick because they were tired, or certainly if they're working hard to breathe or something like that. But, it's impossible to send every child home in the fall and winter who has snot. There would be an empty child care center on every block, right? That's impossible. But I think really good hand washing, modeling that with the, the workers in the child care center, modeling that and encouraging the kids to wash their hands, sanitizing, the toys and surfaces between, activities and children, and, really encouraging families. I think it could go a long way that you all are also giving the same message that pediatricians are, encouraging families to, 1, keep their child home if they're sick, 2, to get people vaccinated. We're all in this together. And, if everyone's sitting their child in daycare when they really feel like they know they should be home, then they're just continuing to spread the same viruses that will then come back to them, 6 weeks later or whatever. So I think, following the protocols that you all have, advocating to families, because, everyone has the same desires, right? That their children can stay in a healthy, safe place, that they can, not be worried that every time they go, they're going to contract something, be out of work. We're all in this together. So that's what I would recommend. That's an excellent question. Thank you. We have another question from our audience members. Again, can you tell us your name and give us your question?
Hi, my name is Eric, and my question is, I recently had a family member who was diagnosed with COVID and had symptoms. So what is the best way for one to care for a friend or family member who is sick with COVID, or even a flu for that matter?
Mm-hmm.
What's the best way that we can support them?
That's a great question. Dr. Etienne, what would you recommend? How can we support our friends and family members who have COVID or the flu?
That's a very good question. And we're, of course, seeing a lot of both COVID and flu. And unfortunately, they still have to be taken care of. Just leave them to fend for themselves. So the best thing to do would be, so if you have an N95 mask, wear that mask anytime you interact with that person. Try to keep the person isolated in the room, alone. But of course, there may be times when you have to go in and give the person, food, leave the food outside the door, let them come get it. You want to minimize the amount of exposure you have to that person while they're still contagious. Make sure you're frequently washing your hands. If that person has to leave the room and they're touching any surfaces, sanitize those surfaces. If you have Lysols, spray the hallways or wherever they are, but definitely wear your mask and wash your hands and kind of keep them isolated, because both COVID and flu are highly contagious, and you want to do everything you can to protect yourself and anyone else in the home from contracting the virus.
Okay, I have a follow-up to that. So at what point are they most contagious?
Well,
Like, how would I know at what point of their symptoms are they most contagious?
yeah. Well, as far as COVID, they're contagious really from onset of their symptoms. They're contagious for at minimum 5 days after the onset of their symptoms, or 5 days after the test was positive. So that's the very minimum. Ideally, you want to try to avoid any direct contact for 10 days. After that 5-day period, you should still, that person can come out of isolation, but they should still be wearing masks for an additional 5 days.
Thank you.
You're welcome.
Excellent question, and thank you, Dr. Etienne. Do we have another question from an audience member? Excellent. Go ahead. Tell us your name and ask us your question.
Hi, my name is Luisa, and I was wondering if a person got their primary series and doesn't want a boost, what could I tell them to help them understand that this is important or that it still matters? You know, they were pretty conscious and wanting to participate and do their part when it was the crux of COVID. But at this point, they're like, what's the point? You know, kind of leave me alone.
Yeah. I want to start this one then. Dr. Etienne, I know you probably have something to say also. So first, I would just kind of have a conversation with them and ask them, like, tell me about that. Like, what are you worried about? Because you got vaccinated with the first, series. And, is it fear, or did they feel like symptoms were, significant? Just kind of get an idea of what it's about. Because if it comes down to they just don't think it's important anymore, then that's a great time to educate that you really don't have good protection if you only had your primary series. That protection has decreased, and it was not specific to the variants that are going around now. And so you really do need to stay up to date with your boosters in order to be protected. So just like we have a yearly flu vaccine, I couldn't expect that I would be protected against the flu this year based on last year's flu vaccine. The vaccine is worn off, and the formulation may be different depending on what is circulating in the community. And so that's how I would start that conversation. And a reminder that, we're no longer talking about numbers of boosters or vaccines. We're talking about being up to date with what's available to you, right? And so that's different if you're 6 months versus 6 years old versus 60 years old, right? And so if there is a bivalent booster, so I had a family today and they said, we're good, we're done. We've got our first 2 doses of Pfizer and we had our booster, and their booster was, 8 months ago. I said, well, don't forget, there is a new bivalent booster that covers you for the circulating variants, that if you haven't had that booster, you are not up to date. You are not fully protected from COVID, which they did not realize. And so it was a good time to educate and then get them vaccinated and protected. So that's how I'd start the conversation. What do you think, Dr. Etienne?
Dr. Monroe, I agree with everything you just said. You pretty much took the words out of my mouth. But I would also note that people are getting a bit of vaccine fatigue, and just kind of to give them some encouragement and let them know, praise them for getting that primary series, and let them know that just like the vaccines that their children get, their children have to get boosters for certain of their childhood vaccines, and you definitely would not deny that child of that, it's the same thing for yourself and your child. The booster is very important in keeping you safe. You have to kind of proceed and keep moving. You don't want to just stop at the primary series or your third booster. And like you said, you want to make sure you have the most updated booster.
That's exactly right. Thank you so much, Dr. Etienne. Are people still dying from COVID? I mean, do we need to worry about this?
Yes, we do need to worry about this. And that's one thing that is my biggest fear, people becoming complacent. People thinking that they're invincible and healthy and nothing's going to happen to me. The numbers have decreased significantly, but people are still dying daily from this virus. Thousands of people are contracting the virus on a daily basis, and people are dying. Young people are dying. It's not just old, feeble people who have weakened immune systems. People who you think may be healthy can succumb to the virus and die. And death is not even the only concern as far as the virus. When you compare COVID to flu, in most cases, when people get the flu, they feel horrible for a week and they're done. But unfortunately with COVID, we're seeing people develop what we call long COVID, and they develop symptoms that can affect them for the rest of their life. This virus can affect your heart, your lungs, it can affect your mental capacity, your level of thinking, it can affect your joints. Any system in your body can be affected by this virus. And there are people whose lives are not the same, people who are young and healthy. I have a friend whose daughter ended up having to have heart surgery in her 20s, healthy as a horse, contracted COVID, had mild symptoms from COVID, but ended up having complications. So we cannot take this virus for granted. This can be something that later on, you can have complications related to the virus. So it's not something that you just want to get and just brush it off. You want to try to avoid contracting the virus as best you can.
That is such a good point. Thank you for reminding us about long COVID, because I think we can get into this place where we think it's either, death is the only bad outcome, where obviously death is terrible and we want to prevent that for ourselves and our loved ones. But long COVID has changed lives of millions of people since this pandemic started. So thank you for reminding us of that also. Dr. Etienne, do you think then that the COVID vaccine is going to be like the flu vaccine, where every year we're getting kind of the updated, vaccine for that season?
Yes, from what it looks like, that will probably be what's going to be the case, because the virus, as we know, the COVID virus is not going anywhere. It's going to be with us. And like I said before, it's a very smart virus, and it will mutate and change on a regular basis. Just like with the flu, each season, there's a different strand of flu. So our vaccines are formulated to protect us against that particular strand of flu, just as what we're doing with the COVID vaccines. Our boosters are tailored to protect us against various variants. So this will be something that we anticipate will be at least an annual vaccine, similar to the flu.
Excellent, thank you. I have another question from a community member. I am going to go ahead and let you introduce yourself and speak up loudly and let us know your question.
Yes. Hello, everyone. My name is Samuel. And this is a question I have regarding an actual event in a family, my sister's house. And they had one of my nephews tested positive for was flu, and the other one tested for something else, which I don't know if it was COVID, RSV. But my question is, should they or can they get vaccinated for both the same day, and if that is recommended? Another question, is it recommended to get vaccinated while you're already sick?
That's an excellent question. Thank you so much for asking that. So what I understand is that your nephews, you're at somewhere at your sister's house, someone was sick with flu, and maybe someone had COVID, and even though you've already had those diseases, should you get vaccinated, and could you get vaccinated while you are sick? So Dr. Etienne, how would you answer that for flu and for COVID?
You definitely don't want to get the vaccine while you're still having severe symptoms. As far as COVID, you want to wait until your symptoms have improved, you don't have fever. In most cases, you have protection against COVID up to about 3 months after the infection. However, you are safe to get that vaccine anytime that your symptoms have improved. If you're pretty much back to normal, you may have a little cough or what have you, within a few weeks, you're able to get that vaccine if you choose to. And it's probably better to get it sooner than later, because we're seeing people get COVID again in 2 months versus that 3 months that we thought the vaccine would, the actual virus itself would prevent you from contracting it again so soon. And the flu is pretty similar. Once you get the flu, once your symptoms have improved, you don't have fever anymore, I would still recommend getting the vaccine, because you can get the flu again. And we see that as well, unfortunately.
Yeah.
People contracting the flu multiple times in one season.
Yeah. Well, and there's different strains of the flu that are covered in the vaccine. And so you definitely want protection. Even if you had flu A and have some protection naturally, you want protection from influenza B.
Yes.
Okay, excellent. That was a great question. Thank you so much. I have a good question for you from someone in the chat, Dr. Etienne. They saw that their COVID-19 home test kit had an expiration date and it was past that. Is it okay to use the home kits once they have expired? And if not, what should they do with it?
That is a great question, because there's so many free kits. People are getting the kits, but the shelf life is not very long for many of them. And we're finding that a lot of those kits have expired. Up until recently, it had been recommended that once that kit is expired, not to use it, because there was no way to know that past that expiration date, if the results would be accurate. So you may have a test that was negative, but it could be falsely negative or positive or falsely positive. But what they have found now is that a lot of the tests have what they call a longer shelf life, and they potentially can extend the expiration date. So the FDA has a website. If you go on the FDA's website and you enter the information, the type of test, COVID test that you have into that website and the expiration date, it will tell you whether you can continue, you can still use that test. So don't throw the test away. Go to the website and enter the requested information in, and they'll be able to tell you whether you can use that test longer. They'll tell you you may have 3 more months before this test is considered unsafe to use.
Excellent. That's really helpful. And while we're talking about websites, I'll just remind everyone that if you're trying to figure out if you have flu or COVID, don't forget that you can help rule out COVID with a free antigen test. And you can still get free tests at the 7 locations all over the county for Wake County Health and Human Services, including here at the Departure Drive location. Just go to wakegov.com/testing. wakegov.com/testing to get one of your free antigen tests. Also, COVID tests, if you are seen by a physician and you have symptoms, they're still covered by your insurance. I know that we had been used to, a year ago, getting a free PCR test at many different locations. And so that's not available anymore if you don't have symptoms. But if you're seeing your physician because you're symptomatic, then your insurance should still cover your COVID test. All right. If we don't have any more questions from our audience members, I'm going to take one from the chat and then come back to the audience. So Dr. Etienne, and we've talked about this a little bit, but people are still anxious. On the news, we've heard that there's going to be a potential surge. Should they be worried? We've talked about, will new variants come out? You've already told us there's always going to be new variants, but should they be worried? And I'm just going to start by saying, I'm over being worried. I will stay prepared, but I'm done with being worried.
Yes.
Am I thinking about that the right way, Dr.
You are thinking about that the right way. And I'm going to go back to March, I'll say about March 14th of 2000. I was worried
Yes.
then because we had nothing to protect us. Like I said, we were sitting ducks. We didn't know much about this virus. We had no vaccines. We had limited testing. I mean, you could be sick and you didn't know what you had because you couldn't be tested for it. So yes, I am sick of worrying as well. What will come will come. It's just like going to war. Back then, I felt like I was going to war without any ammunition, without any protection. And I didn't have it, but now we have what we need. We have our vaccines. We know so much more about this virus. We know that the vaccines are effective. They're free and widely available. People as young as 6 months can get the vaccine. So, we're not as worried about our babies as we used to be because they can be protected. So come what may, we don't know what's going to come, but we know what we have to protect ourselves. We know we have the vaccines. We know what to do to keep ourselves safe. If we're sick, we know that we need to stay isolated and stay at home so we won't spread it to others. We really need to continue what we've been doing throughout the whole pandemic. And just like any season, like flu season, we're in what we previously called flu season, but now it's COVID, flu, and RSV season, which have all started early. We have to do what we can to protect ourselves. If we do those things, we will be fine. So to sit and worry is not helping anything. We know what we need to do and we need to do it so we can all be safe.
I love it. We're going to war, but we have all the tools we need. Someone asks in the chat that they're interested in getting the COVID-19 vaccine. What symptoms or side effects should they expect? And I'll help answer this one. I've gotten my COVID vaccines, my first booster, my bivalent booster. My children and family are boosted, and I've helped deliver several thousands of vaccines. The good news is that for most people, the side effects are really mild, if any. About 1 in 4 people will have something like headache or fatigue or injection site pain, low-grade fever, things like that, that may last for a day or two. I can remember after my first one, I felt tired. I had a headache. My second one, not much. Since then, my boosters, I've really not had any symptoms. I've felt pretty fortunate. Some people will feel crummy for a couple of days. In children, just anecdotally, though they can have the same symptoms as adults, children have been rocking it after vaccines. They seem to really not even have the same side effects as 1 in 4 adults. And so, those are the side effects that are common and that you can expect. That doesn't mean something's gone wrong. That means that your immune system is responding and doing and learning how to fight the virus, which is what it's supposed to do. And I always just remember that the mild side effects from the vaccine are significantly better than the actual infection itself and can help prevent long COVID. So we've talked about that also, not just the seriousness of the disease and how bad one might feel and may need to be hospitalized, but also can help prevent long COVID. I have a question from the audience, it looks like, and I am going to let you speak up and ask your question for us.
Sure. If I take a COVID-19 test before going to a family gathering, like Thanksgiving that's quickly approaching, and let's say it's positive, do I have to miss this holiday with my family? Like, what else could I do? Like, I really would just want to see my people.
Wow, that is a tough question. That is a tough question. And I have thoughts about that. Dr. Etienne, what do you think about that? If someone tests positive before the holiday season, they were being responsible and getting tested, do they have to miss the holiday?
You will miss it in person. You do not need to be around others. You need to isolate if you have COVID. That's just the bottom line. However, there's wonderful technology. Most people have smartphones, have computers. You can do Zoom or Teams or FaceTime. There's so many different platforms that you can use to connect to people while you're isolating. You have to really, I know you'll miss your family, but just think of what would happen if you got someone sick with COVID, especially, in families, we tend to have older people. We have people who are, maybe have immune systems that are weak, young babies and children who, if they contract this virus, they can become very sick. And I don't think that's something that anybody wants to happen. And there'll be other times to be in person. So
yeah, that's the point. Stay safe so that there will be other times.
Yes.
Right. Do the right thing now so that you'll have a safe time to gather and celebrate at a later date. Have someone pack up a plate for you and leave it on your front door so you can, eat your Thanksgiving plate via Zoom with your family members, and hopefully get back to being well and get everyone vaccinated, and hopefully enjoy the next holiday, which is just right around the corner for most people. Enjoy that together. But yes, thank you for being responsible and testing ahead of time, and go ahead and continue to be responsible and protect your vulnerable family members, especially. I have an interesting question. What do you think? What's your opinion on why there was only a 3% increase in African Americans in Wake County who have received at least one dose? So, reminder, back in January of 2022, about 54% of African Americans in Wake County had received at least one dose of the vaccine. And today, about 57% of African Americans have received one dose of the vaccine. And so the uptake has really slowed down as far as people who are, accepting the vaccine for the first time. What do you think about that, Dr. Etienne? I mean, I know when we think about this, and we've talked about this, that of course there's some historical factors, the legacy of mistrust in medicine, which we continue to grapple with. Yes. There have been true harms and injustices that have been that the Black and Brown communities have suffered as it relates to medicine. But what do you think? Is it that? What else is going on?
I think the level of mistrust has a big impact on that. There are still people who, even though the vaccines are out there, they still feel like, hey, I'm fine. And they have other influences that may influence them to not get the vaccine or to not get the boosters. And I think a lot of it too is vaccine fatigue. They may have gotten the primary series and they're like, I'm okay, I never caught COVID, or I got a mild case, so I'm not gonna, get this vaccine. But I think also, even though the vaccines are out there, they still may not be as accessible to everyone. They're there, but can you get to a vaccine clinic? There's not as many vaccine clinics. Initially, we would go out into the community and provide vaccines to the most vulnerable Black and Brown communities. So they were receptive to people who looked like them, giving them the vaccine and making it easier for them. Some people don't have transportation. I mean, there are a lot of factors that come into play. So even though they are available, people, for whatever reason, may not have as easy access as we think to them, or they don't really feel that they're necessary.
Yeah, thank you for answering that. It's not an easy thing to really assess, but we continue to chip away. Yes. and work at it. Again, I do feel grateful that every day in the community that I work in, which Black and brown families
Yes.
for the most part, that every day we continue to have these conversations and we continue to get people vaccinated. So I think it's slowly individual conversations and people that they trust. So hopefully we can continue to move the needle there. We are getting close to the end of our conversation. Only a few minutes left, Dr. Etienne, and we've gone through a lot of things. We've got RSV season, COVID and flu season. One of the questions that is coming through the chat, there's a flu season. Is there a COVID season? It seems like forever now, always is COVID season. There is an expected surge in the fall and winter months, and we really all have to do our part to protect ourselves, our families, and our communities. And so I think parting words from my standpoint are, don't be worried, be prepared. Don't be weary, push on. There's still work to do. This is our new normal, and we have the tools, and let's use them. What else do you think, Dr. Etienne? What else would you say to families as we're moving out into this holiday season?
I would say, like you said, don't be fearful. We have what we need to protect ourselves, and give yourself some grace. I mean, this is something that nobody has experienced before. And be patient with others. If you have family members who are not vaccinated, don't judge them. Speak with them, meet them where they are, and don't be afraid to talk to people. Don't be pushy, but do your best to, meet them where they are, and you may be the person who can reach them to get them vaccinated, because the vaccine is important. Even though the numbers are going down, I want everybody to know that this virus is still impacting individuals, families, and communities. It's become a burden on our healthcare system. People are getting very sick. As physicians and healthcare providers, for the last almost 3 years, it has been very taxing. It has taken a toll on us. So it's not just you as an individual. The decisions we make as far as getting vaccinated and being safe impact our whole community. And it's not just the individual.
Thank you so much, Dr. Etienne. We really appreciate your time tonight, your expertise. I always enjoy doing these with you. I feel like I learned something from you every time we do it also. I just wanted to thank everyone who tuned in. Thank you so much to Wake County for hosting this town hall. And, everyone, please stay safe out there, do your job. Don't be worried, just be prepared. And we will see you next time. Thanks, everybody. Good night.